Well, hi there. Good morning. This is Mark Idelman, speech language pathologist, and welcome to the teaching of talking. Today we're going to have a video about the habits of talking better. And you might go, "Wow, a habit? Yeah, a habit." Many of us are very, very concerned about habits, and habits can be very good, and unfortunately, habits can be not so good. But we want to talk about the habit that's good. And the habit is, for those who have apraxia or aphasia, the habit is engaging in talking every day. Now, a lot of us, if we have a particular weakness, sometimes we tend to avoid. And if we have that weakness and we avoid it and we avoid dealing with it, then what seems to happen often is it stays the same. It either stays the same or it worsens, and we don't want that. So, why do I talk about habits? Well, habits for better talking involve engaging the person who has a speech difficulty in talking every day. Everybody seems to think that you have to go to a therapist, to get your speech better, or you have to go to a conversation group to get your speech better. Well, they're okay. But where the real pedal hits the metal is at home, during all those activities of daily living, when the care partner or the family member learns the principles of stimulating conversation and stimulating speech, especially apraxia too, because apraxia must be addressed usually first before aphasia if it's profound. Because if a person has difficulty with speech clarity, then they've got to deal with the apraxia or with the dysarthria first, and then work with the aphasia, because you can't make any words clear or understood unless it's articulated well, unless the speech motor is working to formulate the sounds which make up the words. So, the habit of speaking is a habit that must be thoroughly developed each and every day for a person who loses their speech or for a person who's never talked before. The problem has always been, however, that the family member thinks that the therapist is the only person who can deal with it, and if for any reason they can't make it to a hospital or an outpatient clinic or an office, then they stop. They get stopped right there. And then what happens is there's no habit for the person who has a speaking difficulty except to avoid. Now, you don't want avoidance. You want a person who's out on the playing field every day doing the best and the very best that they can do towards better speaking. So the things you have to do is, number one, you have to commit yourself to helping the person with apraxia or aphasia. Number two, you have to find a mentor, and you can get started in a book or a video course or anything like that, like we have below. Or you need to just get a mentor that you can meet with every week, who can help you learn what to do and help you identify the specific maneuvers that would be good for your person, because there's no one way to deal with anything. There's no apraxia alike, there's no aphasia alike. And since there's no apraxia or aphasia alike, the approaches are very different and have to be selected by somebody who knows what they're doing. An iPad or a notebook or flashcards are never going to deal with it, and singing happy birthday surely isn't it either. You have to have a skilled person who listens to the person talk who's got aphasia or apraxia. That skilled person will be able to identify maneuvers and techniques that you can develop right away and can teach you what to do and how to do it and to assure that you're doing it well. Now that's when you find an individual mentor, and we have a link down below if you want to find out about personal mentoring. But we also have books, and you can learn much of it yourself, but there's still a certain degree of information that even when you read a book, even when you watch a video, you'll get a lot of information, but you won't necessarily learn the shortcuts or the finer nuances of finding better and faster ways to help a person speak better. So habit then has to be developed for those with aphasia or apraxia. That habit of speaking has to be encouraged throughout the day. It's not during a 1/2 hour visit or 1 hour visit with the therapist. What the therapist can do during that 1/2 hour or hour visit is spend time with the caregiver, training the caregivers so that the caregiver can utilize conversational techniques at home that are fun and functional, not that are out of some book or word list or something like that that has no real connection to the context of the situation. So this is Mark Ittleman. I hope you've liked this little video. Make sure that if you have aphasia or apraxia, or you have a loved one with one of those, that you get into the habit of stimulating their speech 50, 100, 150, 200 times a day. That's what it really, really takes. It's not sitting down in a therapy room and saying 50 or 60 words or sentences. It's just never going to happen that way. It's a commitment. It's a habit. It's a daily habit. It's an hourly habit. It's a weekly habit, a monthly habit, and a yearly habit. So this is Mark Ittleman. We have lots of links underneath this video. So if you want to learn more about apraxia or aphasia or how to help your loved one speak, there's plenty of information under there. If you've liked this video, please give us a thumbs up and subscribe to our channel. Thank you very much and have a great day. Bye-bye now.